Okay, let's briefly talk about the oral and the IP administration to laboratory animals, especially rats. So let's say, okay, we are going to discuss the IP and then oral routes, or let's say what's how to administer drug using IP and then the oral. But it is important to know how to make a calculation on how to get a particular amount to be administered to the rats. So let's say you have a rat of 250 gram, which is equivalent to, 0.25 kg. So assuming you have a particular dose that you want to administer, assume the dose as this dose. Let's say you are aiming at administering 50 milligram per kg of a particular drug. This is the weight of the rats. So now, how to arrive at the exact amount that this animal require is you have to use this. This represents 50 milligram to 1 kg, which is 1000 gram rats. So since our rats for this case is weighing 250 gram, so we can say, okay, the X milligram administered in this 250 gram rats is going to be this 50 milligram by the 250 250 gram, then divide by 1000 gram. Gram goes with gram, then this goes by this, then 5 by this is 125, right? Then divided by 10, you are left with milligrams. So here you are going to have 12.5 milligram. So we now know that this rat required 12.5 milligram to be able to achieve this 50 milligram per kg dosing. So, but now another thing, how do we administer this particular because we want to administer intraperitoneally. So here there is a formula that 0.1 ml for IP is to be administered to 100 gram rats. So now, how much to be administered to this 250? So 250 gram rats. So it's going to be 0.1 ml by 250 gram, then divide by 100 gram. So here, if you do your calculation, this goes here. So you can have 0.1 by 25, 0.1 by 25, then by 10 is going to be 0.25. So here you will arrive at 0.25 ml. So what this means is that you use 0.25 ml of your diluent, could be normal saline, could be DMSO, could be twin, depending on the compound you are going to administer. Then you just use this one to dissolve this particular drug or compound, then you now administer it intraperitoneally. While administering intraperitoneally, there are so many things to be considered. One, the angle of the injection should be around 30 to 45 degrees. Then they should be administered at the peritoneal cavity, meaning the lower part of the abdomen, either the right part or the left part. But the right part is more preferable because it will assist you to avoid some organs such as liver, so that they cannot be affected. And try to use a needle of 23 to 27 gauge. Preferably use 27 gauge needle as it assists in delivering perfectly without much pain. Then that is for the IP administration. For the oral administration, you can still use this one. We have already arrived at the amount of the drug that is needed to be administered to this particular rat. So now what remains is that you should be able to know how much the concentration you prepared. Assuming you prepared 10 milligram, let's say you prepared 10 milligram per mil, meaning you took 10 milligram of this the powder, the drug, then you dissolve in 1 ml. So this concentration is important. So the amount to be administered orally should be the required dose. The required dose or the required amount to be administered. The required amount to be administered all over the concentration, the available concentration. So in this case, you have your 12.5 milligram by 10 milligram. So this is this is 10 milligram per mil, right? So it means this goes here. We will give you 12.5 by 10, will give you 1.25, yes. So we'll give you 1.25 ml. So it means this rat, if you are giving orally, based on what you constituted, you are giving 1.25 ml orally this time around. And you can also consider the recommended oral gavage volume, which is between 5 ml to 10 ml per kg. So let us now consider this one and see if this particular volume falls within that one. The animal is this, right? So if we are taking the lower one, let's say 5 ml in 1 kg. Per kg means 1 kg, meaning 1,000 gram rats. So how many mils would it be administered to 0.25? Okay, we take it to the gram, right? 250 gram. You can do it per kg, you can do it per gram, as the case may be. So in this case, you just cross multiply it and get to x. So it means 5 by 250 divided by 1,000. So still you arrive at the same amount, which is 1.25 ml. So meaning it's within the safe or recommended volume to be administered. Some will go up to this. That is in a situation where the dose is not specified. It has been prepared, then you have to administer to that particular rat. So you now consider you should take between this to this. So if we are taking this one, meaning we are going to give 2.5. So we are going to give 2.5 ml to this particular rat, but this is the maximum. Cannot go beyond this one. So that is how to arrive at this oral, and then the other one is the IP administration. I think it is important now. Maybe we just go and see the rats, then we see how to demonstrate the IP and then the oral administration. Thank you very much. So you need to take the weight of the rat. See, so this rat weighing 363 gram. So you take 0.36 ml, 0.363 ml. animal very friendly to you, so you try to hold the animal. So we now try to see the lower quadrant, but the right part is most preferable, because you want to avoid organs like liver, spleen. So that's that for the IP administration to the right. Oral administration to the right, using oral garbage. Okay, so you get the rat to some extent. Get the rat. Then now hold it carefully and make sure the needle is, the garbage needle is inserted like this. Then you press. Then it's taken already. So you drop the animal.